Meeting of the committee will please come to order. While we expect to call on our witnesses and give us their testimony at 10 o'clock, I did want to have this hour available for members to be able to make opening statements. I will make my opening statement, and Mr. Barton will make his opening statement just before we begin the testimony. But I want to call on members who wish to make opening statements and to recognize them at this time for that opportunity. So let me, Mr. Burgess.
Well, Mr. Chairman, actually, I didn't realize this was the arrangement. I'll waive an opening statement in deference to time for questions because of the firepower we have on our panel this morning. So I'll waive the opening statement.
Very good. We're not going to give you extra time. We'll just have those are rules of subcommittee. Any other members seek recognition for an opening statement? Yes, Mr. Latta.
Well, thanks, Mr. Chairman. If I may, I'd like to waive opening statement, just submit my opening statement for the record, please. My written statement.
Certainly. Without objection, we're going to allow all members to submit written opening statements, and this is an opportunity for those who want to give their opening statements at this in an oral presentation at the committee meeting. Gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. Certainly, I look forward to hearing from these high-powered witnesses, as my colleague from Texas, my physician colleague, just said, and exploring these issues further. However, it seems a bit ironic that we're holding a hearing on the future of medicine and synthetic biology when the future of our health system, I submit, indeed is in doubt. A new study by Towers Watson found that 1 in 6 employers are likely to reduce employment and retirement plan contributions, such as 401ks, to pay for health reform. 43% of employers are likely to eliminate or reduce retiree medical programs because of this bill that we just passed. 90% of employers believe health care reform will increase their organization's health care cost. Employers like AT&T are already filing billion-dollar losses with the SEC. Today, we should be meeting to explore why the Democrats' health reform bill is hurting so many employers and subsequently their employees. Such a hearing might also explore how spending trillions of dollars to turn our health care over to government bureaucrats may indeed may ruin the very market we need to produce groundbreaking new treatments like these witnesses are going to describe to us in this hearing today. With that, Mr. Chairman, I'll yield back my remaining time.
Thank you. The gentleman yields back his time. Mr. Pitt?
Thank you, Mr. Chairman. Thank you for scheduling this hearing. Synthetic biology or synthetic genomics has been in the headlines recently with the news last week that Dr. Venner, who's testifying this morning, has developed the first self-replicating cell to be made from synthesized DNA. Advances in synthetic biology or synthetic genomics have potential applications across a wide variety of fields, healthcare and energy and the environment, to name a few. And synthetic genomics can already be used to produce medications and may possibly aid in tissue reconstruction. In the future, these techniques could be used to create biofuels or lessen pollution. And while these are exciting prospects, I think we all need to learn more about the science of synthetic biology and synthetic genomics. I also think we should carefully investigate the moral, the ethical issues, as well as public health and safety issues that advances in the field are raising. And I look forward to hearing from our distinguished witnesses, learning from them today. Thank you, Mr. Chairman, and I yield back.
Thank you very much, Mr. Pitt. Ms. McNerney, do you wish to make an opening statement?
Thank you, Mr. Chairman, and I want to thank the panel for coming. What a distinguished list of speakers, and they've made tremendous advances in the field, and a lot more to come. Of course, there's always the risk that's associated with these sort of advances, and we want to make sure that we're on good standing with those risks, but the potential for good and in my opinion, outweighs the risk at this point, as long as we keep mindful of that. I just want to say I'm a little disappointed that our colleague from Georgia decided to make this into a political spectacle, but that's what happens in this committee. But welcome aboard. I look forward to your testimony, and thank you.
Thank you, Mr. McNerney. Any other member wish to be recognized for the purpose of giving an oral opening statement? We're going to recess until 10 o'clock. We'll then begin the hearing with opening statements from the chairman and the ranking member, the chairman of the two subcommittees that have a specific interest in this, the Energy and Environment Subcommittee and the Health Subcommittee, and the chairman and the ranking members of those subcommittees as well. And then we were going to call on this very distinguished panel. So we're going to recess now, and all other members will have an opportunity to put an opening statement in writing in the record. We are in recess until 10 o'clock.